Tu peux nous entendre, Gilles?
Très bien.
Alors, moi, je ne t'entends pas. Hop. 1, 2, 3. Gilles, vas-y, tu peux parler?
Oui.
Ah, parfait. Magnifique. So, it was the pleasure of being working in a university with a shutdown of a wireless connection for a few minutes. So, okay, things are working back.
The good thing is that these recordings can be edited.
Yeah, we will cut it. So, Jean-Michel, tu es là avec nous ou tu es parti au café? So, I was asking this question about correlation between borders and spread of death over France. And yes, you are right, Valerie, that the beginning of the pandemic in France has started from 2 events. The first one was a football game in the south of France, and the second one was church, how?
A religious meeting.
Evangelist ceremony where there have been a few people touched. Still, whether even after a few months, I think even I have seen a picture even after 8 months of the pandemic, there was still a gradient over France going from east to west. And at that time, few politicians said it was due to the borders of France. And from my point of view, it's just probably a gradient of age over France. And this was what I was expecting from IGN. Do you have a picture or could you find a picture of a spread of age of the population's age from east to west? Do you have such picture? Or would it be possible to find such picture? I don't ask if you have right now a picture like this, but do you think it's possible to have a picture like this and to study the correlation between this distribution of age over France and the distribution of the death due to COVID-19, for example?
IGN is a big house with many activities, and even in research we have many kind of activities. I cannot give a response, but what I can say is that we have at our disposal a lot of layers of information, all of them specialized. So I guess that I could find the right people, the right person who could work on the fusion and the analysis of such information, especially if we include inside some information related to COVID. Of course, that you can cross these different layers and try to find things, but I'm not sure that I'm quite sure that a lot of people outside IGN has already tried such kind of study.
I have not seen this. To be honest, I have not seen this study. I have tried to find it, but I didn't find it, and I was quite surprised that the journalist didn't try to make this correlation, because it was obvious that the gradient from east to west was just a natural gradient.
Okay.
Oh, okay. So we have Slava who is back with his cats, no cats. And Jean-Michel, perhaps? No, still not. Ah, yes, Jean-Michel is here.
Yes. Are you right?
Yeah. So, Andrea, you have to understand that Jean-Michel is living in the south of France. They have always 5 or 10 minutes of delay. It's,
No, you say 15 minutes.
Yes,
I am on time.
okay.
With respect to what you say, I am perfectly on time.
It's another kind of gradient.
No.
Exactly this. So, is there other question in the room? Probably Juliette. I know that you have plenty of questions.
So regarding the last question about the border, I think if you look into the literature, early border closures would have been the best measure to prevent spread. So this is something, for example, that would not have been impossible in Germany, because people would not understand this, the infection. The main infections into Germany came when people returned from their ski vacation. And it happened that in one of the major tourist places, there was an outbreak. And essentially then people from all over returned to all over Germany. And then you had the disease essentially everywhere. So early travel restrictions would have been a very good measure to prevent the early spreading of the disease. I'm very much convinced about that.
Yeah.
Regarding the correlation analysis with other factors, I'm not sure about the age distribution of France, but what I've seen from papers that have been published that do factor analysis and correlation analysis, root cause analysis, and so on, one big problem that they're facing there, in particular when they analyze the source or the cause of the measure, that many measures have been taken simultaneously, and then you end up with the problem that they produce the same factor loadings because everybody did the same. And then you get there might be 1 or 2 very effective measures, but the computed effectiveness is shared across all the measures that have been taken simultaneously. And this makes statistics really hard, at least to my understanding. I'm not sure we have, I'm just a computer scientist, I'm not a statistician. But maybe somebody can comment on this, how really hard it is to work with the data, in particular in early stages.
No, I can even comment because, okay, we know that this is quite a very hard problem to detect something earlier or at early stage, sorry. This is clear. And whether with respect to the amount of data that we receive from the geography, even if early stage detection is hard due to the multiplicity of data, you can find some feature and some signal. So this is, you know, it's not a recording over time, it's recording over space. It's a correlated, it's sure that it's over space, it's correlated. It's differently correlated than in time, but still you have information. And this information can be used, it's clear. It's more clustering approach. It's a different approach. It's not necessarily detection, but you can find some feature like this as well. So, is there a question? Yep, go ahead.
The correlation I read about your question was between the death due to COVID and the lack of doctors and hospital beds in France. This correlation was made. It's not at all about a border. It's about the organization of the way to cure people and to help people in France. But I have another question. I guess all of us belong to public institutions. Do you think that research in data science may meet the scientific and technical demand of the museum project and of society, or do we have to go through public-private collaborations? Is public research developed enough to meet such demands as the museum's one, and I think many others of the same size.
Tu peux couper ton... Gilles, go ahead.
I do not see any problem about asking about the collaboration with some private entity, but then we should face some problems, some potential problems of marketing, of accessing to some data and so on. So maybe the risk, the balance benefits risk is not so high. I think that as we see in science, in open, in general, in open data science project and so on, you may have some private company and even big company working in it, but well, it's complicated. So I wonder if it's well first using the well, if we speak about fairness and open data and open science, looking at the public entities first is a good choice.
Well, Gilles, I completely stand for public research. My question was the other way around. Will we manage? But I stand for public research, and I hope the museum will be completely or as completely as possible a public project.
If we speak about do we have enough computer space, storage, and GPU to manage that? I think so. But well, so I think that there are enough. We have enough in the public domain, but well, it's just my opinion.
Maybe I can just talk about the new political the new politic of IGN. It is called in French Geocama. I can put you the link here, but it's in French. I didn't find an English version. The idea of the Geocama with the new director of IGN is to try to be able to work in an open environment that makes possible research in public combined with private actors within this global environment, which is called for IGN Geocama. It's the idea of combining everything through this environment. If you can see in the, if you can go to the link, you will see explanation about that. So we can see that if COVID-19 is a COVID common, I don't know how to call it.
It will be a common for the period, yes, for sure.
So it should be possible to let people, private and public people, to work together through this kind of environment. You can read, we have a lot of text. It's a new passion of our director, but it's interesting.
Okay, that's clear.
Just to give an example about the CPU and storage. Well, I'm working on language models, and in language models, there have been some big language models built by companies. The GPT-3 by OpenAI and some by Google, BERT and so on, which are used, and they are, it's monstrous. They are built using hundreds of billions of words and now a billion of parameters. And there is a public or open science project which is called Big Science, and with many partners, and to build a system exactly the same but open, and with billion of parameter, multilingual, and it will be on. It will use the Jean machine, which is a public machine, and it is using only the public administration, only the public storage and public CPU. So I think it is possible.
Yeah. If I can add one word, just to be clear, there is this. There are two things in IA: the learning part and the use of the learn after it has been learned. Learning is CPU consuming. It's really demanding to learn. It's really demanding. But when a model has been learned, to use it, it's just nothing. Just to give you an example, an early example was with the Kinet. The Kinet, it has been processed for more than 1 year. The computing time to learn the model for the Kinet has been made for more than 1 year, and then to use it, you was able to use it on your TV with very, very little tools. So using an IA model is nothing. It's only to learn and to explore the data that you have a demanding part.
I have one question, if I may.
Yeah.
I am just wondering how possible can it be to leverage available informations, like we talk about time machine, right? And we are in COVID museum, and we know that it has been some pandemic and in the past. Is it a way to leverage those, even not a lot of those data, and put them into relations in the data science learning machine to get patterns related to such pandemics and use them for future one? Is it something that is on the pipeline for the COVID museum and the data science?
Someone want to answer?
Well, I can answer about that situation if you're
Go ahead.
Yeah, so basically, historically we had archives, and now we started to split archives into data platforms dedicated for specific disciplines. So for example, we'll have one for social sciences, for other sciences, for computer sciences. So basically what we do, we are forcing people to work with a data platform, and they'll have own ontologies that people can use, right? And after we'll try to build a common ontology for them. So you can think about Wikidata as a kind of common ontology. Of course, it's not possible to interlink different ontologies together. It's a quite difficult task, but at least you can get something linked, and this is how you can create linked data and build analysis in scale. So that's possible if you will first, for user, for researcher, it will be ontology that he or she understands. And after, it should be someone on top who will connect all different ontologies. So this is our approach. And I don't know, we just started, and I don't have answer if we will be successful in the end, but at least we'll try to build something like that.
There is this ontology issue. There is also the fact that you have a spread of the pandemic that we have seen for the first time in real time. And this data is just something which was not available before this pandemic, and which will be available to analyze previous one and further one.
Well, I agree and disagree, because you can think about current pandemic situation. So humanity basically moved in 10 years in development. So we live now in a situation like in 2030, if things will go in normal way, you know. So now everything goes digital, and we work at home mostly, and humanity is just producing digital content. So we are forced to go digital right now, and of course we'll get a lot of data that should be stored and preserved, should be described. So this is kind of opportunity to get everything in place, and if you'll get people from different disciplines working on their part of deal, right? So they can make annotations and descriptions using their own ontologies, so we can get somewhere.
Yeah, I do agree. Yeah, vas-y. Oui.
I have a question for Jean-Michel, if you agree, Jean-Michel. Is there a European Statistics Society? And if so, does it collaborate? And do you think, as I do, that the European level might be the good one for the museum project as it is for Time Machine Europe?
Yes, I perfectly agree with your point. The European level is a good one, and there is an European consortium of society, of national society, which is called Femstart. We play a very important role, notably in the certification of statisticians. We are involved in the certification of statistician process of Femstart, like the Royal Statistical Society, the Scandinavian, the Spanish, the Italian, and other. And Femstart play an important role of increased discussion between national society and support some project, and the European is a good level for the COVID museum project. I perfectly agree with your point. Thank you for that question.
Is there any question in the virtual room? Over question? No. Juliette, do you have more questions? So I think Ioannis, perhaps? No? No. I think we have made a quite a good overview of this link between data science and COVID-19 Museum. I would like again to thank you really all for your participation and for your reflection, for your thoughts. And probably we can keep in touch such that we can go further in this construction of this project, because it's really a long-term project. So, and again, thanks a lot. I think we can stop now with a little bit of advance, but it's okay. Thanks a lot. And I hope that we will be able to organize a meeting in the coming months about the COVID-19 Museum, but in Paris. And you will be more than welcome to participate. Thanks again.
Thank you very much.
Thank you. Bye-bye.
Bye-bye.
Bye, everybody.